Hello viewers, so I am back with my new video for grade 4 lesson number 4 from book 3 of U.A.E Healthcare. So here we have the learning objectives to list different healthcare workers and explain what each does. To explain how to call an ambulance in the U.A.E. To illustrate the steps from calling ambulance to receiving care at the hospital. Now this is the warm-up brainstorm question from the textbook you can go through. So before I proceed further, just a humble request. If you have not subscribed to my channel, please do subscribe it. What are healthcare services? Healthcare workers advise and treat people in hospitals and clinics. Preventive care attempts to prevent or stop an illness or injury from occurring. So they have given us the definition of what the healthcare services include. So healthcare workers, they are the people who are advising and treating the people in the hospitals and clinics. And then there are preventive care attempts so that there is any injury or any illness that could be prevented or stopped from occurring. Then the healthcare workers, who are those people and what are their tasks? Medical doctors work on hospitals and clinics to diagnose and treat patients. When a patient has a life-threatening illnesses, the patient may be referred to a specialist, for example, a cardiologist. A doctor who specializes in heart illness may be consulted if a patient complains about heart problems. At the hospital, a surgeon may need to perform a surgery. So there are different kinds of health workers which we come across. But if there is any life-threatening illness, then the patient is always referred to a specialist. So in this case, they have given an example of a cardiologist who is a heart doctor. The nurses assist doctors in providing care for the patients. Some nurses see patients before the patients see the doctor. So what do they do? What do the nurses do? They measure the temperature, the blood pressure, the weight, the height, and so on. Some nurses prepare patients for surgery, while other nurses take care of the patients after the surgery. That is pre-surgery and post-surgery. So you have the nurses taking care of the patients. Most hospitals have pharmacies where patients get medicine. Pharmacists fill prescriptions by preparing and distributing medicines prescribed by the doctors. They explain how to take the medicine to the patients. So the doctor will only prescribe and will give the prescription to the patient, and it is the relatives of the patient who go to the pharmacist, and in those pharmacies they give the prescription, and there they are advised how it should be taken. Now, there are different kinds of health care workers which we have seen in the previous slide. This is the continuation of it. Other healthcare workers may include the dentist, the physical therapist, and the nutritionist. Dentist, as the name suggests, they are taking care of our teeth. If we have any problem with our tooth or teeth, then we go to the dentist. So they prepare a filling or they pull the teeth out if it is not in a good condition. Physical therapists help people who have broken bones or muscle problems. So they help the people, those who have got fracture, and after the fracture they are still not, getting well. So they give them different kinds of massage and exercises. Then the nutritionists, they advise the patients about the food intake and how the food affects their health. So as the name suggests, it's the nutritionist. So they will help the person by preparing a food chart or a diet chart for him or her. Then what are the steps for calling an ambulance? In case of an emergency, a person may need to call an ambulance. The number to dial in U.A.E is 998. When you call an ambulance, the dispatcher picks and asks for details. Dispatcher is the one who picks the phone because he's supposed to dispatch the ambulance. So he needs to take the details about the residential address, about the condition of the patient, and so on. This dispatcher sends a crew, that is a team of paramedics, to your house. So the paramedics include a doctor, a nurse, and a ward boy. While you wait, the dispatcher may speak to you and calm you down because it's waste panicking. If necessary, the dispatcher may instruct you how to help the person in need. Till the time the ambulance doesn't arrive, there could be some kind of, first aid or something given to the patient so that he feels better. The paramedics may use the siren and the flashing lights to get through the traffic. You must have seen this. These are the common sights on the roads, wherein they blow the siren so that the people in the traffic can move away and they get a clear path to move on to the patient's house. They provide immediate help and transport the patient to the hospital. At the hospital, the patient is checked and seen by the doctors. Once the patient is delivered to the hospital, the paramedics prepare themselves and the ambulance to go to the next call. So now the job of the paramedics, those who are working in the ambulances, their work is over once when the patient is transported to the hospital. After that, they prepare for the next call. Now, this is activity one, very much from the textbook. Please go through. This is activity 2 from the textbook. Please go through. Activity 3 again from the book. Well, this is activity 4 from the textbook. It shows you the steps to be taken while calling an ambulance in U.A.E. This is activity 5. It's a thank you note. I've written it down over here. You can very well add some more points and you can change the names accordingly. So here I come to the end of my video. Thank you so much for watching Learn SST. If you have really liked it, then please give me a like, share it with your friends, relatives, and with your classmates so that they get benefited by my videos. See you next time with my new video. Till then, take good care.